Imagine that you need a surgery, but you have to wait for a long time because your name has been placed on a long wait list because there's a lack of surgeons, and this can cause a potential harm to your health. Now imagine that you have received your degree at a postgraduate level and you have spent probably the best years of your life at university to get qualified for the type of job that you really like, but after graduation, it turns out that there's no one out there to benefit from your knowledge and skills, and you have to remain unemployed or underemployed. This is particularly important for healthcare providers and surgeons due to the high cost of training and long training periods. Fortunately, policymakers are trying to control these situations through the advanced planning of manpower and to make sure that the supply and demand of workforce are in balance. And here is where my work, which is modeling a health workforce system, can provide policymakers with guidelines for resource allocation, training, funding, and help them examine other exogenous factors. However, the stochastic factors involved with workforce models makes modeling and predicting these systems a complex problem. Uncertainties include the effect of technology and its progress on surgeries and operations, the attrition rate of surgeons, number of students who choose higher education and fellowships, male and female providers' preferences, and so on. So a good workforce model should be capable of dealing with all these uncertainties. The benefit of modeling a health workforce system is substantial in a nation like Canada with an aging population, which will significantly expand or alter the demand for health providers, as well as lead to the retirement of currently practicing providers. In spite of the fact that new surgeons must be trained to replace those who leave the system, and excess provider supply brings some unfavorable results. In addition to a waste of time and money, the excess recently graduated surgeons won't be able to find a suitable job position, and this will discourage many new students from enrolling in the training programs. And after a time delay of several years, this will affect the number of available graduates to be hired, and this can cause a shortage of surgeons in the future. This negative feedback, the concept of time delay, and the stochastic parameters makes it most suitable to develop a model from an engineering point of view, a robust adaptive model which would be able to respond to what-if questions and provide policymakers with hiring requirements, number of trainings needed, and a model that ensures a system in which supply and demand are aligned well. Thank you.